My name's Kelly Jackson-Waite. I'm a Macmillan speech and language therapist and I work for Northamptonshire Provider Services. Speech therapy involves working with people who have difficulties with speech or with swallowing following head and neck cancer.
My name is Mick. You will notice that I have to keep pressing this object on the front of my neck. This is the only way that I can speak. It's called an HME, which is a heat moisture exchange.
An example of head and neck cancer is laryngeal cancer. Laryngeal cancer is cancer in your larynx, which is a box-like structure which you can feel in your neck. Your larynx has your vocal cords, which when they move together they vibrate, and that's how you produce voice. And when they do the surgery, they take the whole larynx out, which is at the top of your airway, your trachea, so that they have to divert your trachea so that you breathe through your neck. And they create an opening on your neck so that you breathe through your neck, and they've taken your vocal cords out. So after surgery, we have to find a different way for you to speak. The voice prosthesis is a silicone device which sits between the back of the airway and the gullet. So when the stoma is covered, the air is pushed through the valve, which is a one-way valve, up into the mouth so that voice can be produced by a segment of the pharynx being vibrated to produce voice.
I was told that I would have to learn to speak again after the operation. But 10 minutes after I had the valve fitted, I was on the phone speaking to all my family. It was great. My family could not believe I was on the end of the phone talking to them, because they thought that I may never speak again, or it would be a very long time.
This is another option that laryngectomy patients can use. It's an artificial larynx, and it's for those patients that are unable to have surgical voice restoration because surgery has been quite difficult or complicated. And it works by pressing it onto the side of the neck, and when you press the button, it vibrates to give an artificial speech. The impact is huge for those who are faced with having to go through a laryngectomy. They've got to come to terms with the fact that their anatomy is going to change, that they're going to be breathing differently, they're going to be learning how to talk in a different way. I mean, the implications from on a social level and a psychological level are very different, and it's going to take a long time to come to terms with that. And as a speech therapist, we're available to help them through the whole process. We can provide them with information preoperatively, and also after the operation we can help them with various aspects of the rehabilitation in terms of helping them with surgical voice restoration or other modes of communication, whatever's appropriate for them. But also with the coming to terms with all the different changes that have happened, and the psychological and emotional support that goes with that. And that will go on as long as they need it. And we see them for a long time because they come back for support with their stoma and their speaking valve, and we can offer them what they need.
Anytime I need a valve changing, I just ring them up, and I'm normally in the hospital within 1 hour. And I couldn't ask for anything better than the care that I get from them two ladies.
The most rewarding part of my job is 3 weeks after having a laryngectomy is when you can start teaching the patient how to use their valve. So from not having any speech to suddenly being able to use the speech valve and develop the speech and being able to communicate again with family and friends. I mean, I find that incredibly rewarding. If you have any concerns, contact your local speech therapist or your local specialist nurse in head and neck cancer, or just look on the Macmillan website for the appropriate person in your local area.